Welcome back. In part 1, we shared 5 important tips every senior should know before surgery. Now, let's dive into the final 3 strategies that will help you heal better, safer, and faster. If you haven't watched part 1 yet, we recommend starting there. And make sure to like, comment, and subscribe to stay updated with more helpful content like this. 6. Plan your post-surgery support system. Your circle of care for a smoother healing journey. Imagine trying to climb a steep hill with a heavy backpack, all on your own, especially when you're not feeling your best. It would be incredibly challenging, wouldn't it? Now, imagine having a team of supportive friends and family cheering you on, helping you with the load, offering a steady hand when you stumble. That's the power of a good support system after surgery. After surgery, especially when you're over 70, you'll likely need some help. You might be dealing with pain, fatigue, and reduced mobility. Simple daily tasks that you usually take for granted, like cooking, cleaning, grocery shopping, bathing, or even just getting around your home, can become difficult for a while. Having a well-planned support system in place before your surgery is not a sign of weakness. It's a sign of wisdom and foresight. It's a crucial ingredient for a safe, comfortable, and faster recovery. So, who can be part of your circle of care? Family and friends. These are often the first people we turn to. Spouses, adult children, siblings, close friends, or even supportive neighbors can provide invaluable assistance. Talk to them openly about your upcoming surgery and your anticipated needs. Don't assume they know what you'll require or when. Be specific. Professional caregivers. Sometimes, family and friends may not be available, or you might need more specialized care than they can provide. In such cases, professional home health aides or caregivers can be a great option. They can assist with personal care, meal preparation, medication reminders, and light housekeeping. Your hospital's social worker or case manager can help you explore these options and find reputable agencies. Respite care or short-term rehab, depending on the type of surgery and your recovery needs. A short stay in a rehabilitation facility or skilled nursing facility might be recommended. This can provide intensive therapy and 24-hour nursing care until you're strong enough to return home. Planning your post-surgery support involves several key steps. Assess your needs. Think realistically about the kind of help you'll need and for how long. This will depend on the type of surgery, your overall health, and your home environment. Discuss this with your surgeon and the hospital discharge planner. Communicate openly. Have honest conversations with your potential caregivers. Discuss their availability, their comfort level with certain tasks, and any concerns they might have. It's important to set clear expectations and avoid misunderstandings. Create a schedule. If multiple people are helping, create a schedule to coordinate their efforts. This ensures that you have consistent support and that caregivers don't get overwhelmed. Prepare your home. Make your home as safe and comfortable as possible for your recovery. Declutter pathways to prevent falls. Remove loose rugs, electrical cords, and other tripping hazards. Set up a recovery station, a comfortable chair or bed with everything you need within easy reach. Phone, medications, water, tissues, remote control, books, etc. Consider installing grab bars in the bathroom, a shower seat, or a raised toilet seat if needed. Stock up on easy-to-prepare meals and groceries before your surgery, or arrange for meal delivery services. Arrange transportation. You'll likely need help getting to and from follow-up appointments. Plan this in advance. Don't forget emotional support. Recovery can be an emotional journey too. Having someone to talk to share your feelings with, to offer encouragement and companionship is incredibly important. Your support system provides not just practical help, but also emotional strength. Let me tell you about 2 gentlemen, both in their late 70s, who had similar heart surgeries. Let's call them George and Henry. George was a very independent man and didn't want to bother anyone. He downplayed his needs and went home with minimal support arranged. He struggled. He found it hard to cook. He missed medication doses because he was tired and forgetful, and he felt very isolated. His recovery was slow and fraught with anxiety. Henry, on the other hand, had a frank discussion with his children before his surgery. They worked together to create a support plan. His daughter stayed with him for the first week. His son helped with groceries and driving him to appointments. A neighbor offered to bring him a hot meal a few times a week. Henry felt cared for, supported, and safe. He could focus on his recovery without worrying about the daily chores. His healing was smoother, and he felt much more positive throughout the process. The difference between George's and Henry's experiences wasn't the surgery itself, it was the support system. Having a strong support network can significantly reduce stress, prevent complications like falls or medication errors, improve your nutrition, and promote a more positive outlook, all of which contribute to faster healing. So, start planning your post-surgery support system now. Don't wait until the last minute. Talk to your loved ones. Explore your options. Prepare your home. This proactive approach will give you peace of mind and set you up for a much smoother and more comfortable recovery. Remember, asking for help is a sign of strength, not weakness. It's about recognizing your needs and taking steps to ensure you have the best possible environment for healing. We've talked about physical and logistical preparations. Now, let's turn our attention to a very specific and often anxiety-inducing aspect of surgery: anesthesia and pain management. This is especially pertinent for older adults. So let's discuss. 7. Discuss anesthesia and pain management specifically, navigating comfort and clarity after 70. The thought of anesthesia can be a source of anxiety for many people, and perhaps even more so as we get older. We might worry about going under, about potential side effects, or about how our bodies will react to the medications. And then there's the concern about pain after surgery. How bad will it be, and how effectively will it be managed? These are all valid concerns, and it's crucial to have an open and detailed discussion about anesthesia and pain management with your medical team, particularly your anesthesiologist. Why is this discussion so important after 70? Well, older adults can be more sensitive to anesthetic agents and pain medications. Our bodies may process these drugs differently, potentially leading to a higher risk of side effects. One significant concern is post-operative delirium, a temporary state of confusion, disorientation, and sometimes agitation that can occur after surgery, especially in older patients. While usually temporary, delirium can be distressing for both the patient and their family, and it can sometimes prolong recovery. So, what should you discuss with your anesthesiologist? Your medical history. Be sure to share your complete medical history, including any previous experiences with anesthesia, good or bad, any allergies, and any conditions like heart, lung, kidney, or liver disease. Mention any neurological conditions, such as Parkinson's disease or a history of stroke, as well as any cognitive concerns, like memory problems. Types of anesthesia. There are different types of anesthesia, and the best choice for you will depend on the type of surgery, your overall health, and your preferences. General anesthesia. This is when you are completely unconscious during the surgery. Regional anesthesia. This involves numbing a specific part of your body, such as an arm, a leg, or the lower half of your body. You may be awake or lightly sedated with regional anesthesia. For some procedures, regional anesthesia can be a good option for older adults as it may carry a lower risk of certain complications like post-operative confusion, nausea, and vomiting compared to general anesthesia. Local anesthesia. This numbs a very small area of your body and is typically used for minor procedures. Ask your anesthesiologist about the pros and cons of each suitable option for you. Discuss strategies they might use to minimize risks, particularly the risk of post-operative delirium. Post-operative delirium prevention. Ask what measures the hospital and the anesthesia team take to prevent delirium. This might include careful medication choices, maintaining oxygen levels, managing pain effectively, promoting early mobility, ensuring good sleep, and keeping you hydrated. Family members can also play a role by providing familiar faces, reassurance, and helping to reorient you if you do become confused. Bringing familiar objects from home, like photos or a favorite blanket, can also help. Pain management plan. Effective pain control after surgery is not just about comfort, it's vital for your recovery. If you're in too much pain, you won't be able to move around, take deep breaths, or participate in physical therapy, which can increase your risk of complications like blood clots, pneumonia, and muscle weakness. Discuss the pain management plan with your anesthesiologist and surgeon before your surgery. What kind of pain should you expect? What types of pain relief will be offered? Advocate for a multimodal approach to pain management. This means using a combination of different types of pain relief methods, rather than relying solely on strong opioid medications. Opioids can be very effective for severe pain, but they also have side effects like drowsiness, constipation, nausea, and an increased risk of confusion and falls, especially in older adults. A multimodal plan might include non-opioid pain relievers like acetaminophen or NSAIDs like ibuprofen, if appropriate for you. Regional anesthesia techniques like nerve blocks that can provide pain relief for hours or even days after surgery. Local anesthetics injected into the surgical site. Non-drug therapies like ice packs, heat, relaxation techniques, or transcutaneous electrical nerve stimulation, TENS. The goal is to achieve good pain control with the fewest side effects. Be open with your medical team about your pain levels after surgery. Don't try to be brave and suffer in silence. Your nurses and doctors need to know if your pain is not well controlled so they can adjust your treatment. Let me share a story about the importance of this conversation. Mr. Henderson, a robust 80-year-old, was scheduled for a major abdominal surgery. He had a previous surgery where he experienced significant post-operative confusion, which worried him and his family greatly. This time, during his pre-anesthesia consultation, his daughter specifically brought up this concern. The anesthesiologist listened carefully, reviewed Mr. Henderson's history, and tailored a specific anesthetic plan. They opted for a combination of regional anesthesia and a lighter general anesthetic. They also had a clear plan for managing his pain post-operatively with minimal opioids. The result? Mr. Henderson had his surgery, and this time, he remained clear-headed and comfortable. His family was immensely relieved, and he was able to participate actively in his recovery from day one. Your anesthesiologist is a specialist in perioperative medicine. They are there to ensure your safety and comfort before, during, and after surgery. Don't hesitate to voice your concerns and ask questions. A good discussion can alleviate many of your fears and help ensure that your anesthesia and pain management are optimized for your specific needs. Navigating medical conversations can be tricky, can't they? Sometimes we leave the doctor's office and think of a dozen questions we wished we'd asked. What's one question you wish you'd asked your doctor before a procedure? Or what's a tip you have for communicating effectively with your medical team? Share your wisdom in the comments below. Let's build a community of informed patients, helping each other advocate for the best possible care. And if you want to keep getting these insights, these tools to empower your health journey, make sure to subscribe to the channel and hit that notification bell so you never miss an update. We're nearing the end of our 8 essential pillars. We've covered so much ground, from initial assessments to anesthesia. Now, let's focus on what happens immediately after your surgery and how you can actively participate in your own healing. This final crucial point is all about 8. Prepare for post-operative mobility and care, embracing movement and vigilance for a strong recovery. The surgery is over. You're in the recovery room, or perhaps back in your hospital room. What happens next is just as important as what happened before and during the procedure. The immediate post-operative period is a critical time for healing, and your active participation is key to a successful outcome. This involves embracing movement, understanding how to care for yourself, and knowing when to seek help. The move to improve mantra. It might seem counterintuitive. You've just had surgery, you're sore, you're tired. The last thing you might feel like doing is moving. But early and regular movement, as guided by your medical team, is one of the most powerful things you can do to speed up your recovery and prevent complications. Why is movement so important? Prevents blood clots. Lying still for long periods increases the risk of deep vein thrombosis, DVT, or blood clots, usually in the legs. These clots can be dangerous if they travel to the lungs. Moving your legs, wiggling your ankles, and getting out of bed and walking as soon as it's safe helps keep your blood circulating. Prevents lung complications. After surgery, especially if you've had general anesthesia, your breathing might be shallower. This can lead to a buildup of fluid in your lungs and increase the risk of pneumonia. Deep breathing and coughing exercises, as taught by your nurses or respiratory therapist, help keep your lungs clear. Getting out of bed and moving also helps your lungs expand fully. Prevents muscle weakness. Atrophy muscles can weaken surprisingly quickly when they're not used. Early mobility helps maintain your muscle strength, making it easier to regain your independence. Stimulates your bowels. Anesthesia and pain medications can sometimes slow down your digestive system, leading to constipation. Moving around helps get things moving again. Improves mood and reduces fatigue. Being active, even in small ways, can boost your spirits and help combat post-operative fatigue. Your nurses and physical therapists will guide you on when and how to start moving. It might begin with simple exercises in bed, like ankle pumps and leg lifts. Then, with assistance, you'll progress to sitting in a chair and then walking, perhaps with a walker or cane at first. Listen to your body, but also gently push yourself as advised. Each step, no matter how small, is a step towards recovery. Understanding wound care. Your surgical incision needs proper care to heal well and prevent infection. Your nurse will show you how to care for your wound before you leave the hospital. Make sure you understand how to keep the wound clean and dry, whether you need to change the dressing, and if so, how and when. Any restrictions on bathing or showering. Signs of infection to watch out for. This is crucial. Be vigilant for increased redness, warmth, or swelling around the incision. Pus or drainage from the wound, especially if it's yellow, green, or foul-smelling. Fever, a temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius, or as advised by your doctor. Increased pain at the incision site that's not relieved by your pain medication. If you notice any of these signs, contact your doctor immediately. Early treatment of an infection is essential. Medication management continues. You'll likely go home with prescriptions for pain medication and possibly other medications, like antibiotics or stool softeners. Make sure you understand how and when to take them, and for how long. Keep that medication list handy and updated. Follow-up appointments are key. Before you leave the hospital, ensure you have all your follow-up appointments scheduled with your surgeon and any other specialists. These appointments are vital for monitoring your progress, removing stitches or staples if necessary, and addressing any concerns you might have. Don't skip them. Knowing when to call the doctor, the red flags. Apart from signs of wound infection, there are other red flags that warrant an immediate call to your doctor or even a trip to the emergency room. These might include sudden shortness of breath or chest pain, could be a sign of a blood clot in the lung or a heart problem. Calf pain, swelling, or redness in one leg could be a sign of a blood clot in the leg. Uncontrolled pain, persistent nausea or vomiting, inability to urinate or have a bowel movement as expected. Any other symptom that worries you. It's always better to be safe than sorry. Trust your instincts. If something doesn't feel right, get it checked out. Patience and perseverance. The marathon, not a sprint. Recovery after surgery, especially after 70, is often a marathon, not a sprint. There will be good days and not so good days. Be patient with yourself. Listen to your body. Rest when you need to, but also strive to meet your mobility goals. Celebrate the small victories. Being able to walk a little further, needing less pain medication, accomplishing a daily task on your own. These milestones are important. Remember Mrs. Peterson, 76, who had knee surgery. She was a determined lady. Her physical therapist gave her a set of exercises to do at home. Some days, she felt tired and sore, and the exercises felt like a mountain to climb. But she persevered. She remembered her therapist's words. Every little bit counts. She focused on her small achievements. And slowly but surely, she regained her strength and mobility. She attributed her successful recovery not just to the skilled surgeon, but to her own commitment to her post-operative care plan, especially the movement and exercises. Preparing for post-operative mobility and care is about being an active, engaged participant in your healing journey. It's about understanding your body's needs, following medical advice diligently, being vigilant for any warning signs, and approaching your recovery with patience and a positive attitude. This final pillar ties everything together, ensuring that the benefits of a well-prepared surgery are fully realized. Recovery is indeed a journey, and every step, every effort, counts. What's one piece of advice you'd give to someone preparing for surgery or recovering from one? Or perhaps you have a personal story of resilience and recovery you'd like to share. Your insights are so valuable. Please share your thoughts in the comments below. And if this guide has been helpful to you, if it has shed light on this important topic, please share it with anyone you know who might benefit from it. A friend, a family member, a neighbor. Knowledge shared is care multiplied. And of course, don't forget to hit that like button if you found this useful, and subscribe for more content dedicated to your health and well-being. Conclusion: your journey to a stronger recovery. And there we have it. 8 essential keys to unlock a faster recovery and sidestep complications when undergoing surgery after 70. Let's quickly recap these pillars of strength. 1. Comprehensive preoperative assessment and honesty. Your truth is your power. 2. Medication management is crucial, navigating the pharmaceutical maze safely. 3. Optimize your nutrition and hydration, fueling your body for healing. 4. Prehabilitation. Get moving safely, building resilience before surgery. 5. Understand the procedure, risks, and realistic recovery, knowledge for peace of mind. 6. Plan your post-surgery support system, your circle of care. 7. Discuss anesthesia and pain management specifically, ensuring comfort and clarity. 8. Prepare for post-operative mobility and care, embracing movement and vigilance. Facing surgery at any age can be daunting, but armed with this knowledge, you are no longer just a passenger on this journey. You are an empowered, informed, and active participant. You have the tools to work in partnership with your medical team to prepare your body and mind, and to navigate your recovery with greater confidence and resilience. Remember, age is not just a number. It's a testament to your strength, your experiences, and your wisdom. And that wisdom, combined with proactive preparation, can make all the difference in your surgical outcome. This journey is about more than just getting through surgery. It's about reclaiming your health, your vitality, and your quality of life. Believe in your body's ability to heal. Trust in your medical team. And most importantly, trust in yourself. You have the strength within you to navigate this challenge and emerge stronger. Thank you for joining me on this journey of discovery and empowerment. I hope you found this information helpful and reassuring. If you did, please give this video a thumbs up, subscribe to the channel for more empowering health content, and share it with those who might find it valuable. Your engagement helps us reach and support more people. Until next time, take care, stay informed, and be well. Your health is your greatest treasure. Cherish it, protect it, and advocate for it every single day. You've got this.